Well, good morning, everybody. Almost afternoon. Welcome to the Greater Bloomington Chamber of Commerce's 2023 Health and Business Luncheon. My name is Eric Spoonmore, President and CEO of the Greater Bloomington Chamber of Commerce, and very delighted to be here today with all of you. As the voice of business, the Chamber has continued to engage in issues that affect our members and the community for the past several years. This event, our Health and Business event, has been a forum for discussion on a variety of issues ranging from the opioid epidemic to the future of healthcare. I recognize a lot of familiar faces from the last event that we had about a month ago at the History Center, where we dived into some local issues surrounding the challenges of homelessness. And I think what we all took away from that conversation was that this is a very deep and complex issue. There is a lot of life trauma that people experience that lead to issues of substance use disorder, mental health disorders, and we really need to face this head on as a community, as a state, and as a nation to get the resources we need to get people the help that they need. And so we see this event here as just the next iteration of that conversation. We're very fortunate and grateful to have three very knowledgeable individuals joining us this afternoon that'll delve into the emerging public health challenges that Hoosier communities are facing today. This panel of public health experts will provide valuable insights on how the state of Indiana is working to deliver public health outcomes that support and strengthen our local communities. We'll hear from the Indiana Deputy Health Commissioner, Pam Pontanis, followed by a Q&A session with the panel where we invite you all to ask any questions you may have on the topics discussed. You'll see on your tables some note cards. Feel free at any time, you can start now if you'd like, to put your questions on those note cards, hold them up in the air, and a chamber staff member will come by and collect them for the panel. Before we begin, I'd like to take a moment to thank our sponsors for today's event. Without their support, we wouldn't be able to offer these events. The Bloomington Health Foundation, thank you very much. IU Health Bloomington, thank you very much. And Building Associates, thank you for your support of the Chamber. Appreciate everything you do to help us put on these programs. I also want to recognize some elected leaders that we have here in the audience for this very important discussion today. Isabel Piedmont Smith of the Bloomington City Council. Where you at, Isabel? Penny Githens, County Commissioner. Kate Wiltz, President of the County Council. Jennifer Crossley on the County Council. We have Lori Kelly, Health Administrator for the Monroe County Department of Health, joining us today, as well as Diane Young of Senator Todd Young's office in attendance with us today too. So thanks to all of our elected leaders and government folks who are here listening to these important topics. We need your partnership on these issues if we're going to get and achieve meaningful change. And so now I would like to introduce Dr. John Sparzo with IU Health and welcome him to the podium here to say a few words. Welcome, Dr. Sparzo.
Good afternoon, and thank you for having the opportunity to speak with this group. It's an honor to be here today, and would like to share a few things that are maybe a bit of a tangent from what the panel will discuss, but I wanted to make use of this opportunity to share with you some thoughts that are important from an IU Health perspective. Go to the next slide, if you would. You know, up here we have our IU Health Way, and I want to emphasize that one of our key elements is our vision to make Indiana one of the nation's healthiest states, and a lot of people that I heard named here and those that I see in the audience share that commitment that we hope to do together. As part of this commitment, 2 years ago we moved into that lovely building that you see before you. And as part of the commitment to deliver to this community the needs that they have for health care. I joined IU Health just in August of last year as the Chief Medical Officer for the region. And of course, being a part of this and seeing this new building, a lot of things impacted me immediately, right? It's easy to access. There's a lot of beautiful uplifting and healing spaces there. But you know, what really matters to me is what goes on inside and how the building works for people. I'm just going to highlight one element that I think is fascinating about that. Many of you may not know we have 2 separate radiology suites there. That means that we can always see our emergency cases as they need to be seen from the emergency room or inpatient without interrupting the flow of our outpatients who have scheduled visits and have their lives to live afterwards. A simple innovation, but really makes life better for all. I was also very impressed by the continual investment in state-of-the-art technology and physician and provider recruitment to ensure that residents of Bloomington, Monroe County, and the entire region are always getting state-of-the-art care. But it's not all unicorns and rainbows, as they say. There's a couple of issues that have been a struggle since moving into the new building. And I want to discuss some of those two items with you today as important leaders in this community. I want you to know what IU Health is doing to address those difficulties we've had. The first one is overflow capacity in our ED. We're far too often overfilled, not just in the ED, but in our inpatient units. The second one is making sure we provide access to primary care as the main employer of physicians and other providers in the area. It's on our obligation for us to ensure we're meeting the community need, and that's been a struggle as well. So the first issue is you can go to the next slide. First issue is on overflow capacity in the emergency department. Might be easy to wonder, how can we run into that problem with a new hospital? Didn't we plan well? Wasn't this the right thing? Wasn't this designed the way it should be? And I think the answer is, yes, it was designed with a lot of great minds about it, but things continue to change. This hospital was designed before COVID, for example. It was designed long before all the staffing challenges that we've encountered in healthcare have occurred. And, you know, it's good news in the sense that we're living longer, but we're living longer with more chronic diseases, driving more hospitalizations. So we don't find that this is an acceptable situation, having people having to be boarded in our ED, waiting for beds up on the medical and surgical floors. We know it's a national problem. In fact, in November, a year ago, over 36 professional organizations, including the American Medical Association and the American Nursing Association, sent a letter to President Biden, and they said boarding in the emergency department is its own public health crisis. Why is it a crisis? Well, patients are not getting all the care that they need when they're in the ED. It backs up care for those waiting to be seen by an emergency department provider. So we understand the state and national context, that this is a problem, but we're not just going to sit and wait for that to be addressed at a state or national level. We're working on it actively now in Bloomington. I wish we had time to go into some of the details of the great things that we're doing, but I'll say the focus is, for us, trying to optimize the length of stay for patients who are admitted to the hospital. If we get people out of the hospital at the appropriate time, when they're safe and ready to do so, this obviously opens up beds for those waiting in the emergency department. But it does more than benefit those waiting for beds. It actually benefits the patient who is discharged at the right time. We all know hospitals are unfortunately full of germs that are antibiotic resistant. We know that people, especially elderly people who spend too long in the hospital, tend to get delirium and confusion issues. So getting a patient to the next level of care where they can really continue their recovery is actually a critical part to the whole management of that patient's illness. Now, the concern might be, if we're trying to optimize people's length of stay, right, are we pushing people out? Are people leaving the hospital too soon? And we are aware of that concern and that risk. And I'll tell you that we look at a measure of that called our readmission rate. How often within 30 days does a patient come back to the hospital because of the same or a different problem? And I'm proud to tell you that even though we've significantly reduced our length of stay for our patients, our readmission rate has actually declined, and we lead the IU Health system with the lowest readmission rate. The other thing you might wonder is, will people be dissatisfied with their care? Will they feel like we're not giving them their time? I can say that for our inpatient care, our inpatient patient satisfaction scores have actually been improving during this time as well. So what it tells me is delivering the right quality of care to the people at the right time and in the right way is a satisfier, and it gets people exactly what they need. The second item that I wanted to discuss briefly was access to primary care. that's critical to promoting our vision of making Indiana one of the healthiest states. And I'm pleased to report that the wait time for a new patient appointment with a primary care provider with IU Health in the Bloomington area has been decreased by 70% in the last year. How has such a significant change been realized in such a short time? Well, first of all, key element of recruiting of primary care doctors. We had a loss of primary care doctors during the pandemic years of 2020 and 2021. Since that time, we've replaced those doctors and added 6 additional physicians since that time. In addition to physician additions, we also hired 8 what we call immediate access providers. These are nurse practitioners or physician assistants that work in the primary care offices. And they together have created 550 same-day or next-day appointments per week for residents of Bloomington. Third, we created a dedicated call center for new patients. So we have specialists who are taking calls for new patient requests, and they're experts in finding ways to get people scheduled in a more timely fashion. And then fourth, many women use their OBGYN as their primary care provider. Not long ago, we had a 2,000 patient wait list. With the 3 new OBGYNs that have recently joined us, I'm proud to tell you that is almost at 0 now. So significant improvement. As I mentioned, it's not all unicorns and rainbows, but I am pleased and proud of the way IU Health has met head-on this access to primary care issue, and I think tremendous progress has been made. 70% reduction in the wait time, as I mentioned, and we're not done. We plan to continue to improve that. I wish I had some more time to talk about, would you go to the next slide, our partnership with Indiana University, our work in promoting community health and health equity, but time is short. I will leave you with this. While we understand that emergency department boarding and our bed capacity is a significant challenge, as we did with primary care access, we're going to address head-on those issues with the emergency department, and I would hope in a year from now we're going to have a very different story to tell of how we've made that significant impact. With that, I thank you for your time and appreciate your attention.
Thank you, Dr. Sparzo. Now I'd like to introduce Bloomington Health Foundation President Michelle Gilchrist to the stage for a few remarks and to introduce our speaker for today's program. She'll also moderate the panel later in the program. Please help me welcome Ms. Gilchrist to the stage.
Well, Eric didn't realize when he invited me to moderate, you should never give me the mic. So I'm going to put him on spotlight for a moment. I want to take time to really commend his team for doing a fantastic job. They have coordinated and have put thought for several months into what this particular day would look like. And so from me to you and your team, job well done. I really like the fact that back in October, we had the opportunity, many of us here, to participate in the community conversation around mental health, homelessness, substance use addiction, identify some of those issues, some of those problems. And then today, to be here and to have our state representatives here to kind of shed light on some of the challenges they face as well, but also some of the solutions. And then for me as an organization, Bloomington Health Foundation, for those that aren't familiar with who we are a funder. We're a foundation that grants funds based on recognized or identified issues. And what we call our model is lead and convene. What that means to us is that we like to say that we're going to take the lead in identifying a complex problem. A complex problem oftentimes that many have difficulty raising their hand and say, yes, let's tackle that. But then we're not just going to raise our hand to say that we're going to identify what the problem is. We're also going to convene the right players around the table to make sure we have meaningful conversations on how do we devise solutions. So for us, lead and convene means that it's not just us in the room that can solve the problem. The state can't solve it. The facilities can't solve it. The government can't solve it. The local governments can't solve it on their own. It's going to take each of us to come around the table to share our expertise and to leverage our respective resources in order to see the change that we desire. So for us, I'm happy and honored to have several of our board members here today as we start exploring ways that we as an organization intend to invest in this new idea, this new initiative. As Eric mentioned earlier, mental health and substance use is very complex. It's a very complex issue. It's an issue that we have to first accept that it won't be solved overnight. And I think oftentimes we approach mental health and we approach substance use and addiction as something that we want to see an overnight solution to. Well, you can't expect an overnight solution to a long-term challenge. There's many challenges. It's a multifaceted problem that's going to require a multifaceted solution. So for us, we are in the early stages of exploring how best to devise a solution. So in December, so October, we had the community conversation, thanks to Eric and his team. Today, we're having the state conversation and really are really excited and looking forward to the information that you'll receive. But what I hope that you would gather from today is what is it that you and your organization can do to convene and come around the table. Not everyone will have the knowledge, the clinical expertise, the interaction with those that are impacted by mental health and substance use addiction, but there's something each of us can do to encourage support for those that are taking up that challenge, for those that are willing to step into the ring, if you will, and to tackle a very difficult problem. So in December 8th, our organization have secured consultative services with Johnson Gross Nickel and Associates to do just that, to bring to the table those that are doing the hard work, rolling up their sleeves every day, going down to the trenches, trying to make a difference, trying to make a change, despite the fact that the odds oftentimes are against them. But what we want from this group, what we want from this conversation is for us to have a conversation on what are the problems, but also what are the solutions. We can't tackle all the problems at one time. So what we would like after that particular summit is what we're calling it, is for us as an organization to present to our board several opportunities for us to invest in long-term funding. Long-term doesn't mean indefinite. So let me put a caveat there. It's not indefinite funding. It is how do we use our resources as a funder to complement the work that's being done while also understanding that there's other resources that are also being invested in our community so we can leverage our resources to see the outcomes that we desire. So from me to you and from our board, I thank you for the opportunity to be a part of Bloomington and be a part of this great work. And I encourage you to encourage us as we step into this very difficult discussion and very difficult conversation as we want to make a change, we want to make a difference, and we want to make sure that what we began, that we could see positive impact and positive changes in the lives of people that really utilize the services. So with that, Eric, never give me the mic, but I couldn't go without commending you and coordinating your team for all that's gone into the mental health discussion. So with that, now I would like to introduce our speaker, Pam Pontanis, who will give us an introduction of today's topic. Pam Pontanis has served at the Indiana Department of Health since 1990. She began her career as a microbiologist in the IDH laboratory and transitioned to the Epidemiology Resource Center in 1999, serving in various roles in infectious disease epidemiology. Since 2009, Pam has served as state epidemiologist, overseeing many surveillance initiatives, data projects, and outbreak responses. She served as the incident commander for the investigation of the first MERS case in the U.S. in 2014, as a unified commander for the Scott County HIV outbreak in 2015. In February 2017, she was appointed Deputy State Health Commissioner overseeing the Epidemiology Resource Center, Division of HIV, STD, Viral Hepatitis, the Office of Public Health Performance Management, and the Issues and Challenges Division. She has served in key leadership roles for many public health responses, including COVID-19, Operation Allies Welcome, and MPOX. In October 2022, Pam was named Deputy Health Commissioner of Local Health Services, leading and working committees for Indiana Governor's Public Health Commission, serving as principal investigator for the CDC Public Health Infrastructure Grant, building regional staffing teams to support Indiana's 95 local health departments and representing Indiana in the 21st Century States Learning Community. She created and leads IDOH's leadership at all levels programs, which serves employees across Indiana's executive level agencies. She is an agency spokesperson and presenter for infectious diseases and numerous public health issues, and also serves as the vice chair for the Senior Deputies Commission of the Association of State and Territorial Health Officials. Pam is an adjunct faculty member for the IU Richards M. Fairbanks School of Public Health and is a member of the Delta Omega Honorary Society in Public Health. She is the vice chair of the Senior Deputies Committee of the Association of State and Territorial Health Officials and an active member of the Council of State and Territorial Epidemiologists. In 2022, she completed the National Preparedness Leadership Initiative with Harvard University, was a scholar in the 2010 National Public Health Leadership Institute, and a fellow in the 2001 Mid-America Regional Public Health Leadership Institute. She graduated cum laude from Indiana University Bloomington with a BA in biology and minor in journalism and holds an MA in microbiology from IU. With that, we want to borrow part of your energy and definitely your brain for sure, but with that, let's please welcome Pam Pontonis.
Good afternoon, everyone. It is an absolute pleasure to be here with all of you here back in Bloomington. Bloomington used to be my home, graduating from IU, and I have a son who is a senior here studying sports broadcasting. So that's always awesome when one of your children attends your alma mater. So it's great to be back in Bloomington. And I do want to send best wishes from Dr. Lindsay Weaver, our state health commissioner. She was scheduled to present to you today, but she unfortunately could not make it. So I'm covering for her, but she certainly sends her best regards. I wanted to share a little bit of information with you today about Health First Indiana. How many of you have heard of Health First Indiana or the Governor's Public Health Commission? So we have a few folks in here who have. So I really wanted to take a few minutes just to share a little bit about that initiative and really what it means for public health in Indiana. I've worked at the Indiana Health Department for over 33 years, and this is really an unprecedented time for public health in our state. Health First Indiana really transforms public health statewide through state and local partnerships to deliver core public health services at the local county level. And it's really at the heart of where it is. Senate Enrolled Act 4, which was passed by the 2023 Indiana General Assembly this past April, provides Health First Indiana funding, so state appropriated funding, starting next year, 2024, and through the 2025 biennial budget year, so that counties locally can determine the health needs of their communities and implement evidence-based programs focused on prevention. And we heard some discussion about how do we look upstream to address some of the intractable public health issues that we've had in our state for a very long time, and that COVID-19 really showed a spotlight on some of those long-standing public health issues and health disparities that we have in Indiana. So with this funding, and really was enacted through this legislation to help enact the recommendations of the Governor's Public Health Commission that Governor Holcomb convened in August of 2021 to review Indiana's public health system from a variety of different ways. The commission deliberated on the research and the information that was provided, and then in July of 2022, developed a report that summarized those findings in the form of 32 recommendations to improve public health in Indiana. The first of those being developing a measure of core public health services that would be available to all Hoosiers, no matter where they live, offered through the local health departments and their partners in their communities. The Health First Indiana funding provides the support to be able to do that. So recurrent, stable funding specifically for public health in Indiana. And that's the first time that this has happened, and it gives rise to the name of Health First Indiana, because we know that this is the first appropriation of its kind to support public health, and we also know that by putting health first for folks, that we improve our economy, we improve our education. It's really the bedrock for success of our communities. Counties decide whether to opt into this new funding and to provide those core public health services, which is the only requirement of that funding, is that the local health departments, in collaboration with their partners, will use that funding in the delivery of core public health services. Those include things like trauma and injury prevention, chronic disease prevention, maternal and child health, infectious disease prevention and control, and many more. The funding is not prescriptive, and it's meant to be that way so that counties can choose their own priorities based on their health indicator data, based on what is happening in their communities. And again, the goal is to ensure that all Hoosiers have access to those core public health services that allow them to achieve their optimal health and well-being, because we know that good health is the foundation of our ability to thrive, both from schools, the economy, and onward. With this funding, $75 million has been appropriated for local health departments in 2024. That will double to $150 million in 2025. That, by comparison, for the last 20 years, 95 local health departments have split about $6.9 million. So that orders of magnitude above what local health departments have received in the past. That investment in prevention will lead to healthier communities and workforce, which we know attracts businesses to our state, attracts families to our state, because it results in lowered healthcare costs, higher productivity, and folks willing to come to Indiana. Health First Indiana funding also brings together partnerships through local elected officials, the local health departments, clinical healthcare systems, and community partners. And these partnerships are what really allow us to identify the gaps in services and to reduce duplication so that we can ensure seamless delivery of those services. It also benefits our rural communities, which have had significant public health challenges over the last several years, because they often have fewer resources, such as free health screenings and connections to care, that this funding will then allow local health departments and their partners to be able to provide. I'm really pleased to announce that Monroe County has opted in to receive the Health First Indiana funding. Some of you may already know. In 2023, Monroe County Health Department, through the typical amount of state funding that they've normally received about $125,500 in 2023. $125,500. In 2024, that number increases to $1,577,217. And in 2025, at a minimum, that number will increase to over $3 million, going directly to public health in Monroe County. So again, orders of magnitude above what is typically seen both in Monroe County, but then also our other counties that have opted in as well. And for this first time, 86 of our 92 counties opted in to receive that funding. And that means that 96% of Hoosiers have access to Healthcare Indiana funding, an investment in prevention for our state. So just to give you some highlights of the Monroe County Health First Indiana budget, looking to grow their team a little bit, senior community health specialists to assist with harm reduction and naloxone provision in the area of substance use disorder and mental health, population health and outreach manager to connect with the suicide and overdose fatality review team, tobacco programming to support better maternal health outcomes, continued partnership with the Bloomington Fire Department Mobile Integrated Health Services Partnership to provide home health services support for immunizations, maternal and prenatal care, meal delivery, harm reduction outreach, and health screenings. And then population health and outreach training, which focuses on training for referrals for clinical health needs, such as tobacco prevention and cessation, WIC connections to women, infants, and children, and harm reduction in the areas of substance use disorder. Also, in other areas of core public health service delivery, looking to increase disease intervention specialist staff, purchasing some diabetes, heart, and cholesterol screening kits for health fairs and classes, and then partnerships with IU Health to promote chronic disease prevention, as well as public health nursing support, and WIC food pantry support as well. So big partnerships in the community, especially in those areas. Along with substance use disorder, in Indiana, during 2022, as we look at comparing 2022 to 2021, Indiana experienced a 9% decrease in overdose deaths in 2022 compared to 2021, the first year that a reported decrease was noted since 2018. And in a great note, preliminary data for 2023 indicates that that trend is continuing. Through the 1115 Medicaid waiver, Indiana's 2.1 million Hoosier Medicaid members have access now to a full range of substance use disorder treatment. The detection of increased overdose activity allows us to identify hotspots through data collection and analysis and inform local partners for response and intervention. IDOH has also expanded efforts with coroners' offices and harm reduction programs to examine drug paraphernalia through our laboratory to determine the prevalence of substances that may be identified and then inform community partners about trends in substances that are being used. Indiana distributes 24,000 doses of naloxone every month through a partnership with Overdose Lifeline, and some of you may be connected to Overdose Lifeline here in Bloomington. This includes vending machines, nalox boxes, local health departments having naloxone to be able to distribute, first responders having naloxone on hand, and then a network of over 200 grassroots distributors for naloxone, which is that rescue drug that can be given in the event of an opioid overdose. The build-out of the 988 Crisis and Suicide Lifeline and the state's crisis continuum ensures that Hoosiers have a direct connection to compassionate, accessible care in times of distress. So we're really excited to see those advances. Regarding mental health, suicide and overdose death rates in Monroe County for 2022 signaled a continued need for innovative and collaborative solutions. And I'm really excited to hear about what is happening here in Monroe County. Monroe County highlights the innovative and collaborative work include the Stride Center success, law enforcement-based social work teams, community health workers with collaboration with the Monroe County Fire Department, increase in number of naloxone boxes and access to naloxone in collaboration with the local health department here in Monroe County, and multi-agency collaborations toward community solutions. Senate Enrolled Act 1 codified the investment in the behavioral health crisis response systems, and we'll probably hear more today from our colleagues regarding that, and certified community behavioral health clinics, or CCBHCs, to strengthen the behavioral health treatment ecosystem. And I'm really excited to see that move forward and to hear more about that on our panel this morning. So again, it gives me great pleasure to be able to share with you some of the highlights of what we're seeing in Monroe County in the mental health and the substance use disorder space. We know that continues to be a huge challenge here in Indiana, but really excited to see what Monroe County and what communities throughout the state are doing to really address that and move forward in how we can best serve those folks in our communities who are affected by substance use disorder and mental health conditions. Again, I want to congratulate all of you on the progress that you've made, and excited about the work ahead with Health First Indiana. And again, it's my pleasure to speak with all of you today. Thank you so very much.
Okay, thank you very much. Very informative, by the way. At this time, I want to invite our panelists to come up and join Pam on the stage. And as they're coming up, I want to introduce who they are, not give so much of a bio, but just more of an overview of who they are as our panelists. Okay, Doug Huntsinger is the Executive Director for Drug Prevention, Treatment, and Enforcement, and Chairman of the Indiana Commission to Combat Substance Use Disorder. Did I say that correctly? At Next Level Recovery. For the state of Indiana, Lindsay Potts is Division of Mental Health and Addiction, Director of Systems Transformation. Is that correct? Very good. Please join me in welcoming our panelists for today. As a reminder, there are cards on your table that we would like for you to complete and pass those forward, or wave them in the air and someone would grab them. But you got, okay, to wave them in the air and someone will grab them. Quick question, where are they? Give me 1 second here. I don't see them in here. Okay. Yeah. We had several people provide questions, and we're going to begin with those. Thank you. Appreciate that. Okay. For our panelists, let's start first with a question for each of our panelists. Pam, since you started first, I'm going to ask, as a Deputy Health Commissioner of Local Health Services, how are you coordinating with local health departments to improve mental health and combat substance use at the community level?
Thank you. Can you hear me? Yeah, thank you. So there are, within those core public health services that I mentioned, there are some intersections with mental health and substance use disorder within the space of trauma and injury prevention, for example, where we can use the Health First Indiana funding for naloxone provision. We can use funding also in the space of access and linkage to care. And that is a big space where local health departments can link folks who need access, who don't have access to mental health and substance use disorder services, but actually make those connections with community partners. And I do want to underscore one feature of Health First Indiana funding is that it does come directly to the local health departments after the decision was made locally to opt into the funding through local elected officials. But that doesn't mean that the local health department has to do everything itself. The beauty of the funding is that local health departments are encouraged to establish community partnerships with entities in the community that are already doing this work. Maybe that is the expertise or the history they have, and bring those folks to the table to be able to establish relationships, partnerships, and use this funding to support the work that's being done, especially in a sustainable way. So by working to identify those partners in community and being able to provide access and linkage to those services is a big part of where local health departments engaging with partners can advance and move in the reaching folks to care in mental health and substance use disorder. Also looking at the areas of programming for maternal and child health, especially in the areas of mental health and substance use disorder. So a lot of referral, a lot working in the harm reduction space, naloxone, and others. So a lot based on community partnerships. And I would also say, too, that in looking at Health First Indiana funding, businesses were a huge supporter of that funding. So really looking to them through wellness programs and other initiatives that they have to continue partnerships in this space as well.
Before you, I have a question about Health First funding. Does it include seniors?
Yes. So the Health First Indiana funding, again, the beauty of this is that it's flexible to meet the needs of the community, and this includes everyone. So we look to local health departments in collaboration with their partners to identify the community needs. One example is that may touch on this directly is identify a leading cause of trauma and injury in your community and implement evidence-based programming for prevention. So that's very broad, it's very general, because it's meant for communities and local health departments to look at what is pertinent for them. We know through data that falls, it represents a leading cause of injury, especially in seniors. So a community local health department may look to that and say, okay, we know that falls account for a large proportion of injury in that particular age group. What programming can we implement with our community partners to be able to prevent falls? What are those causes and what can we do to prevent them? So it's meant for everyone.
Very good, very good. Doug, you're on point next. As Executive Director for Drug Prevention, Treatment, and Enforcement, could you elaborate on how Indiana is balancing between enforcement to curb illegal substance use and ensuring adequate treatment facilities for substance abuse?
Yeah, so I think for far too long, frankly, our nation was too singularly focused on enforcement. And what you saw over just, frankly, the past few years has really been a push to look at addiction as a disease and to treat that regardless of the setting. And that's one of the reasons that we have really focused on the justice system. You know, with 80% of individuals in the justice system having a diagnosable substance use disorder, for us, we see this as ground zero as a place to have an impact. And that starts by separating those who we're afraid of versus those who we're mad at, and using the sequential intercept model as a way to map the system, but also to look at those appropriate off-ramps. And at each step of the way, whether that is before someone's arrested or before they are booked into the jail or once they're in front of the judge, having individuals there that can make decisions at each step of the way. Is this the appropriate setting for an individual? Or is there somewhere else that is more appropriate that they'll be successful in? And so that's why We funded the IRACS program, which is essentially just putting peers in our jails, because we know that when we provide people navigators and help them work through the system, we get better results. Many people, as they're leaving the jail, they get into a car with someone that they're not supposed to be with, or there are things in that car that shouldn't be there. So they violated their probation before they're even off of the jail property, or their orders of release. So for people who need to be in jail, we have engaged with the Indiana Sheriff's Association. We have 39 jails across the state who are working to implement evidence-based treatment, including MAT for individuals. And this work has also permeated through our Justice Reinvestment Advisory Council, which is chaired by Chief Justice, or not Chief Justice, but Associate Justice Christopher Goff, who looks at how can we empower our local JRACs across the state to begin to do this work within their communities to really bring alignment between the state priorities and the locals as well.
Very good. Very good. Lindsay, I think this question is for you, I think.
Okay.
How does a community best identify and or prioritize the various people and communities who may need access to mental health? In other words, how do we find who needs help most? How do we identify those in need?
Well, so, and can you all hear me? I don't know if this is...
Yes.
Okay. So the question is, how do we identify those who
At the
need
local level, yes.
At the local level, absolutely. And so, nice to see everyone here. Just wanted to heads up, I am a resident of Bloomington, so excellent to be surrounded by fellow community members. And so one of the interesting things I think about this community as it relates to this question is that we have a very interconnected and collaborative workforce that works together to identify those who need help the most. So I've worked with both Centerstone and IU Health, two agencies that provide safety net services for individuals in substance use disorder crisis or mental health crisis. And both of these systems work as much as they possibly can to get individuals to the right care at the right time. And so individuals who, here we go, sorry about that. And so there's a lot of different ways that the system changes right now that are happening that are a part of what I am leading at the state level will help support this already good collaborative work is the three pillar crisis system. So you heard 988 mentioned earlier, which my little bling here, which is the new national number. It's this behavioral health crisis lifeline. And so what this number represents is access 24/7 for individuals who may be experiencing a behavioral health crisis in Indiana. And those individuals that call from Indiana will receive an Indiana call center, which is huge and critical for getting access to our local resources. So that is our first pillar, which is called someone to call. The second pillar is someone to respond, and these are the mobile crisis response teams. And so Centerstone here locally in Monroe County has lifted up a mobile crisis team that's in conjunction with the Stride Center here to respond to individuals in the home, in the community, when an individual is in crisis. And then the third pillar, which is a safe place to be, is the Stride Center. So one of the great things about the Bloomington community was being really at the forefront of developing this resource. It is, I think, in year 3, 4, started in the middle of the pandemic. So what about a challenge, right? Was to build up a brand new crisis receiving and stabilization services is the technical term for this. But this is basically a place for people to go who are in crisis. That is not the emergency department, and it is not jail. So this is huge, right? Because a lot of individuals that are in crisis may be signaling in ways that we don't really understand. And it may be disruptive to the community, it may be disruptive to business, and it may be, for some, kind of scary. However, it doesn't mean that that individual necessarily needs to be charged with anything, to go to jail where they then create more problems for themselves, or go to the hospital where there's not the appropriate, they don't need that treatment level. So the Stride Center has been critical to divert individuals from those systems and to also get them into long-term care. Because at a Stride Center, there's time. An individual can be there up to 23 and a half hours, but really as long as they need to find access to the treatment that they need. And so that access point that both Pam and Doug are talking about as far as that intercept modeling, but also the connection to resources, is really critical for individuals that are signaling to us that they need help. So that's one of the critical ways that I think kind of that question integrates into the bigger system changes that we have, is that we have more options now than ever to identify people in crisis and offer them solutions that are not our typical safety net systems, which are jail and the emergency department.
Absolutely. Yep. Very good. This is general, so whoever wants to answer. What steps are being taken to expand the number of mental health providers? Is it possible to train mental health technicians who are entry-level providers or who have experience in an underserved area of care? In other words, in our area, it's very difficult, as you know, living here, to attract doctoral level psychiatrists or those in that space. So what are alternatives in our community for that?
So I can take that one too, and Doug may be able to chime in a little bit with some of their work with peers that extends beyond the information I provide. So absolutely, our behavioral health system, if you're newer to it or have been around for a while, anytime anyone's probably tried to access therapy or trying to find a psychiatrist or anyone to prescribe medications, it's exceptionally hard to a point at which it almost feels like you're losing your mind even more, right? So this is not for, and this is across the board. And me accessing services for myself and my family have had those same issues in Bloomington. I've lived here my entire life and have worked here for my entire career, and I cannot find it. So just to reiterate and underscore the fact that this is a critical staffing shortage, right? So to that, we absolutely have to create innovative solutions to get access to everyone who needs care, no matter what their needs are. So we talked a lot about crisis needs, which are really where we're saving people out of the river, right? But how are we stopping people from falling in? And so we need to create solutions that help individuals throughout the entire continuum. So not every individual needs a psychiatrist. Not every individual necessarily needs somebody who's master's or doctoral prepared to provide their treatment. Some individuals need that level of care, but a lot of folks just need some guidance and need some additional support. And so in the workforce language, these are called extenders. So these are individuals that are interested in doing mental health care, but are really interested or not necessarily at that point of competency where they can do the master's prepared or prescribe medications. And these are critical to our workforce. Doug mentioned peers as well. Peers, individuals with lived experience, are really a treasure trove of hope. And this is where we've just really tried on the state side through different initiatives and trainings and infrastructure development around how do we get more individuals with lived experience accessing and engaging in the behavioral health workforce as a part of the solution. So those are some of those innovative paths forward. I will highlight in Centerstone here, because I think the community mental health centers, and Centerstone being the community mental health center for this county, have led this for years. And it is something that the community mental health centers really haven't had a choice. They had a huge population to serve. They had to figure out how to get individuals engaged and trained. And so we're continuing to learn from our partners in that space around how do we continue to strengthen those opportunities that some of our providers have been doing for quite a long time.
Yeah, very good, very good. Doug, I'm going to address this question to you. We have discussed acquiring a Fourier transform infrared spectrometer. Hope you know what FTIR is. You know what that is? Okay, we're gonna maybe or help them out, Pam, if this is something in your space. To analyze what is in illicit drugs, but we are not sure the state health department will allow it. Can you tell us how we might be authorizing the FTR spectrometer?
Yeah, so my understanding is, so this is essentially a mass spectrometer that identifies the substances which individuals would be using. It's not health department issue. It is a how do you take drugs that are illegal? How do you handle? How do you take them from an individual without law enforcement involvement? Where is there's a lot of legality here in the law. There is not a exception for these types of programs. The Department of Health does their testing through our syringe service program. So those syringes, we're testing the residue that's left over to find out what individuals are using that are visiting our syringe service programs. That's a legal way to find out what is in the drug supply. But my understanding, the Monroe County model is really because they're wanting to take the drugs from the individual themselves. That's where you get into the legal issue of possession and those types of charges that might follow.
Got it. Understood. Very good. These next two questions are about funding. How does the funding address mental health issues and drug prevention in the schools?
So, the Division of Mental Health and Addiction has worked really hard to sort of overhaul the way they're addressing the work that they are doing in the prevention space. So, one, starting with looking at primary prevention and targeting individuals who are at highest risk, and how do we identify them, and then what programs, ensuring that those programs that we're delivering are evidence-based. Before, we'll say, 2016, 2017, we were funding a lot of programming that didn't have a lot of science behind it. And so over time, the division has really worked to make sure that any programming that's being funded by the state is evidence-based. We now have regional prevention coordinators that are working with our schools, with our community providers, to build those bridges, to help ensure that that there is access to the schools. I know Youth First works in this space and works in this community and does a lot of great work in identifying those high-risk kids and then connecting them with the services that they need. And there are ways in which we are looking with national opioid settlement dollars at how can we do a better job to reach even deeper, not just through schools, but through all of the touch points that we have, whether it be through our recovery hubs, through different programmings, and not just looking at kids, but also the entire family. Because we know that when a person is in active use, is even in recovery from substance use disorder, the family still has those lingering impacts. And so how do we help connect all of those individuals to resources?
Very good. We're getting close on our time, so I'm going to be mindful of your time. So I'm going to take the next three questions, but if you have any questions that you would like to provide, please get those written and get those to me. So the next question, Pam, I think this is probably in your space. What initiatives are underway to address methamphetamine production and addiction?
Thank you. In really, this kind of falls into the general space as well. But our trauma and injury prevention program, our division, does look at data to see what proportion of drug use and overdose or substance use disorder may be due to methamphetamine, our methamphetamine use. Our environmental health division also looks at cleanup and remediation of properties that may have been involved with production of methamphetamine, really trying to make sure that we can provide through the Department of Health, Trauma and Injury Prevention Division, as well as local health departments and their partners, educational programming around prevention. So really looking at how we can address different audiences, different ways of messaging in that prevention space. But really also, too, making referrals. is, and you've heard this mentioned too, is making sure that local health departments have the ability to, whether it's methamphetamine use or whatever the substance may be, looking to have the ability to know who's available in their community for those touch points, as Lindsay was mentioning earlier, and then how can we get those folks access to care, whether that's through transportation, whether that's through partnerships. So that's what local health departments are really engaged with now. With Health First Indiana funding is to be able to have folks on their teams or to establish support partnerships with others in the community to provide that. And we've seen where some local health departments are bringing on social workers or others who can help make those connections through their mobile integrated health programs or other outreach programs that they're developing.
Very good. Do I have time for one more question? Okay. Our final question, I might have two. So two, okay. Okay, our last two questions. What initiatives are leading the way to address the support needs of our, I'm not sure what that means, but oh, IDD, sorry. It stands for Electoral Development. Okay, got it. Who wants to tackle that one?
No, this is a great question. I think in a lot of ways is a population that oftentimes gets overlooked when we're doing policy and system changes. So the good news is it did not get overlooked when we were developing our crisis system development that I just got done discussing, which is 988, someone to call, someone to respond, and a safe place to be, is inclusive of the intellectual disability and developmental disability population. And the intention of this is to make sure that we have a crisis ecosystem and structure for any individual, no matter what their needs are. And so anyone who is engaging in this space is required to have what's called a no wrong door policy. What this indicates is that they will accept any individual in crisis as long as they are not at a risk that's high where it could be dangerous to the individual or others. And so what this means is that we're having to get creative. These things are having to be interagency collaborative, where individuals who are experts in this space are working directly with our providers in the crisis system. I would say we're still at the infancy of this. However, the system change that is happening is that this will be an inclusive system that will not leave out this population in other ways, in ways that it has previously before.
Very good. And our last question, and then I'll turn it over to Eric Spoonmore and thank our panelists. Opioid settlement money, how is it best used and accessed? Is it through health programs, bricks and mortar? What exactly, and Doug, I know this is your question, what exactly can it be used for?
Yeah, so best used is just like looking at our Indiana First funds. It is doing that environmental analysis, understanding where your what providers you have, what are your challenges, doing that assessment early on really then begins to lay the groundwork for where are your gaps and how do you go about filling them. That's what we've done at the state. You know, going back to methamphetamines, we've worked hard to ensure that we've been blending funding from the beginning to ensure that regardless of what your substance of choice is, that we are funding, that we're providing funding for substance use disorder and not having a drug-specific strategy, which has put us in a really good place, especially in some communities where methamphetamine use has been really the drug of choice for that community. Even throughout the entire opioid epidemic. So by doing those assessments, it really begins to help communities understand. And I'll just say where we see the most success is when there is collaboration, when these conversations take place in the open, when your multidisciplinary teams are together. You know, I've heard from a lot of elected officials that say, this isn't really our space. This isn't what the county does. This isn't what the auditor, does, where who the money passes through. Town clerks who say, this isn't what we do. And I say, have those community conversations, come together, and begin to understand who your providers are, what are they doing, where do they see the gaps, and begin to bridge those, those gaps with this funding, and also look to ways at which you can use state funding to assist in that. So we have provided $19 million in match funding to 43 communities. Please don't fact check me on this, but 43 communities that goes to work to help maximize those dollars in ways of collaboration and helping to provide those connections between the infrastructure. But then also we're looking at how do we help build out recovery housing in communities. And these aren't things that the state can do. Over the next year, we're going to add 432 beds to our current residential, or our current recovery housing bed count. That is huge. We have not been able to utilize our current funding streams to do this. So I also look at you or challenge you to look at creative ways in which you can solve problems like transportation, things that Medicaid makes difficult, or other funding streams within the community have restrictions on. These are a little freer. There's ways to be creative, and I'd encourage everybody to look outside the box for those solutions.
Very good. I want to thank Pam, Doug, and Lindsay for a job well done, and thank you for taking your time to be here. So with that, let's give them a round of applause, and I welcome Eric Spoonmore back to the podium.
Well, again, thanks everybody for being a part of our Health and Business Luncheon, especially to Doug, Lindsay, Pam, Dr. Sparzo, and Michelle for your great moderation. Appreciate everything that you've done. I also wanted to make sure, since we heard a lot about Stride today, that I get this phone number out for everybody. Hold on here just a second. And this can be as we mentioned, when people are in crisis, it's good to call Stride first. You don't have to call the police, and we can get people the help that they may need. 1-877-463-6512. That's the number you'll want to call to the Stride Center. We're very fortunate to have that resource here in Monroe County, but be sure to put that in your contacts and call that number if necessary. Also want to say a final thank you to all of our sponsoring organizations that made today's event possible. Thank you for helping us build a better community through better business. And I just have a couple more closing remarks here from the Chamber before we wrap up today. Our next Business After Hours event will be tomorrow, actually. It's not on a Thursday this month. We're doing it on a Wednesday out at Ivy Tech. So it'll be the Ivy Tech Showcase from 5:30 to 7:30 p.m. Great opportunity to network with other businesses and see what Ivy Tech is offering the community. And then finally, the Chamber is hosting its Federal Focus event presented by Indiana University in December on December 11th. And that will feature U.S. Senator Mike Braun at 11 a.m. to 1 p.m. at the Switchyard Park Pavilion. You can register for either of these events by going to chamberbloomington.org. So again, thank you everybody for joining us today, and hope you have a wonderful rest of the afternoon. We are adjourned.